Assalamualaikum and a very good evening to all of you. So today we would like to we are in this meeting. Would like to discuss and analyze about regarding this topic of alarming mental health issues present in Malaysia workplace, and we will be using Dr. Shiba's 7-step as our analytic tools. So this analytic tools consists of 7 steps before we solve a problem, which is the first one is the definition. This step is to get a clear understanding about what is our problem. And the second step is data collection, which we can gain more information related to this problem. The third step is cost analysis. So based on the data collected, we will be trying to answer the question of why this problem occurred. So the next step is solution planning, which so based on the causes that we have collected just now, we will be propose a solution or maybe one or two solution to solve this problem. So after that, we will be doing evaluation effects, whether to check whether our solution is works or not. So if it doesn't work, so we have to find out a better solution for the causes. And next is standardization. This is to check whether the solution can be generalized and applied widely or no. And the last step is evaluation process, where we evaluate this whole process of solving the problem so we can improve in future. So to start this our topic, our analyze to this topic, from the article, I can say that our problem is about mental health. Which what is mental health? Mental health is a disorder that affect our mood, thinking, and our behavior. This will include the stress, anxiety, and burnout. Also decrease productivity, decrease our productivity. So regarding so based on the article, mental health has been the least issues to be spoken among the safety and health officers. So maybe Arif, would you like relate to our next step of this analytic tools?
Okay, thank you. My name is Mama Arif, and I will explain the second step of Dr. Shiba 7 steps, which is a data collection. For data collection, we are using the original article from a Department of Psychiatric University Kebangsaan Malaysia Medical Center, and the title is a burnout, mental health, and quality of life among employees of a Malaysian hospitality. And then this data collection indicates that they are using 256 respondents from the hospital that we classified into 3 main causes of stress analysis, which is an anxiety system, stress system, and personal burnout. And then we move forward to the third step of Dr. Shiva's 7 step, which is a cost analysis. And then for the cost analysis, the main factor of anxiety system, which is bullying or harassment. Bullying, discrimination, or harassment at work can have a serious negative influence on developing depression system. Feeling of powerless, guilty, and melancholy can result from being the target of abuse from another workers. And then in the interpersonal conflict between the workers can develop anxiety at works. And then we move to the stress symptom. For the stress symptom, the main factor that cause the stress symptom is a role ambiguity. Stress system may be developed by unclear employment expectation, ambiguous duties, or contradictory role demand. Stress and anxiety can be brought on when employees struggle to perform competing responsibility or unsure about their job needs. And then for the third cause analysis, which is a personal burnout. For the personal burnout, the main factor is a poor workplace environment. The factors such as a toxic work culture, lack of social support, inadequate communication, or conflict within the workplace can contribute to chronic stress and burnout among the workers. For the next step, I pass to uh, L. Nurul Shazwani.
Okay. Okay, for the next step, which is the solution planning. For the first aspect, which is the humanistic, from the problem, which is discrimination, the solution is propagate clear policies and procedures, which is the clear policies and procedures against harassment and discrimination was developed and propagated. These policies these policies are to make sure all of the employees have to aware of these policies and have easy access to these policies, and there is a channels for reporting actions of discrimination or harassment which enable people to do so confidentially. For the second aspect, which is the environmental friendly, for the problem, which is the organization change, and the solution is the enhance the use of natural elements, which we enhance the use of natural elements at work by including the outdoor areas and components from nature like plants and natural lights. These components have been shown to reduce the stress and elevate mood and also improve general well-being. Okay, and the last aspect, which is the technological and economical feasible, and the problem is work-life balance. And the solution is is encourage a healthy work-life balance by implementing policies that support feasible working hours and also regular breaks and paid time off. Okay. Employees are encouraged to disconnect from work during non-working hours. So this allows employees to manage their personal responsibilities and also reduce their stress that associated with long working hours or conflicting demands. Okay, I will pass to Shazwan for the evaluation effects.
Okay, so I will explain about the evaluation effects on all of the that Fitra has provided. Firstly, propagate clear policies, well-communicated policies, and procedures facilitate early intervention in cases of discrimination and harassment. They outline the steps for reporting and addressing incidents, ensuring a timely response and resolution. Prompt action can prevent prolonged exposure to toxic situation, mitigate harm, and contribute to a healthier work environment. Next, the use of natural elements. Natural elements such as plants, natural light, and view of nature have been shown to reduce stress levels. Exposure to greenery and natural environment has a calming effect on the mind and can help lower anxiety and stress levels among workers. This can contribute to improve mental health and overall well-being. Lastly, the implementation of flexible works arrangement. This can help alleviate the pressure caused by long commutes, work-life balance issues, and other stresses associated with rigid work arrangement. Flexibility empowers employees to have more control over their work environment, discouraging excesses overtime and supporting employee personal time and responsibilities. These help prevent mental exhaustion, which contribute to improve mental health. By implementing this comprehensive approach, it is possible to create working environment that will reduce mental health issues in working environment. Then I will pass to
Sorry, Shazwani. So do you think, sorry to disturb, but do you think, based on the evaluation effects, do you think that the solution is works or not? So that we can apply the solution, or do we need to find another better solution, or no?
From the evaluation, I found that it will be very, from the evaluation, it is found that the solution are successful to reduce the mental health issues in working environments, so we don't have to find new solution. We can proceed with the solution that HR provided.
All right, thanks
So-
to Shazwani for a stunning explanation about the evaluation effect before. So let's move to the step 6, which is standardization. So the first solution that can be implemented is awareness and education, which will developing comprehensive educational programs and awareness campaigns to promote understanding and recognition of mental health problem among workers. This includes providing information about common mental health condition, their signs and symptoms around mental health in the workplace. The second one is a screening and assessment. By implementing standardized tools and protocol for screening and assessing mental health issues, this could involve using validated questionnaires or assessment to identify symptoms, and this will identify the symptom and risk factors associated with the various mental health condition. So the third one is policies and procedures. By establishing clear policies and procedure that address mental health concern in the workplace, these policies should emphasize widely and non-discrimination, and also provide guideline on how to support employees with mental health challenge. Next, we will move to the step 7, which is the evaluation process of mental health problem. So it typically involves a comprehensive assessment of an individual's mental health status, symptoms, and related factors. Here are some key steps that involve in the evaluation process. So the first way is initial screening by using will help identify individuals who may be experiencing mental health issues. This can be done through self-questionnaires, interviews, or checklist designed to assess common mental health, such as depression, anxiety, or stress. The second one is a clinical interview. A clinical interview is conducted by a mental health professional, such as psychologists and psychiatrists, to gather detailed information about the individual's mental health concern. The interview may cover various aspects, including the nature, duration, personal history, family history, and any precipitating factor or stresses. So the third one is a diagnostic assessment, which is a diagnostic assessment is conducted to determine if the individual meets the criteria for specific mental health as outlined in the widely accepted classification system. So the last one is a psychometric testing. By using these testings, such as standardized psychological assessment may be used to gather additional objective data about individuals' mental health. These tests assess various domains such as cognitive functioning, personality traits, or specific symptoms. They provide many information that can aid diagnosis, treatments, planning, and monitoring progress over the time. So that's all from my part. So I will pass to Ain Shazwani.
Okay, so from the discussion that we made just now, do you guys think that these tools, this Dr. Shiba 7-step, is very suitable to solve this problem about alarming mental health issues present in Malaysia workplace?
Yes.
Okay,
Yes.
so to come up to the solution, I also think that this Dr. Shiba 7-step is very suitable because we can see that all of the solutions, our evaluation effects, and by standardizing the solution, we can promote mental health issues that present in our workplace, so that in future we can prevent this to happen, right? So I think that's all from me. Thank you. Thank you all of you for committing in our discussion. I'll see you next time. Thank you. Thank you very much.
Thank you, everyone. Bye.
Thank you. Bye.
Thank you.